Good afternoon, everyone. How are you? Friday afternoon, lovely weather.
Yeah.
Dr. Erickson here, all right? Executive Health Solutions, Physical Therapy, Chiropractic, your herniated disc experts again coming at you.
Jake with Central Motion Spine and Sport here. And today we're going to talk about some chiropractic work. So the adjustment, what we're looking for, and then we'll demonstrate an adjustment to today too.
We've been consistent in the last couple of weeks coming at you with some very specific conditions, right? Body parts, back, neck, shoulder, and then like a lot of exercises and movements that we would have you do for home. But what we haven't shown yet is what our experts, do with the chiropractic side of things. Now we have, chiropractors here, that work here, and we work together. We talked about a video of that last week.
Yeah, I think earlier 2 days ago or something.
The reason that we do them together. Well, here's why. If you have any wonders or any fear of like, ooh, I don't know if that's right for me. I see these videos on TV or these or YouTube or whatever on the internet of like all this, whipping the necks and stuff around. It's not like that, first of all, okay? And if it is, then you may be in the wrong spot. But I want to show you what, have Jake show you, okay?
Yeah.
How he assesses the way the bones and joints move and where some spots might be that's a little bit stiff or not moving correctly. A very specific movement through that joint and kind of what it looks like. So you take it away. So you're the expert on this.
You said you were kind of sore somewhere today, so
I am. So I've been doing a lot of kettlebell swings, right? For the month of October, I'm almost done. I got maybe 800 or so left for my march to 10,000. By doing all that, what I have found is my lower back has been quite sore from the increased volume of doing all of that, but also just from my workouts this week, I've been consistent. I haven't missed a day, and I'm just overall general stiff and sore. Not in a bad way, not a negative pain way, but some good manipulations and movements from a trained expert on this. Generally it helps me feel better. So I was going to have him do it anyway today before I left for the day, and so I was like, well, let's show people how it works.
Perfect. Well, let's go through some ranges of motion. Let's just check out your neck here. Go ahead and tuck your chin to your chest. Yeah, we're just looking for any loss of motion or any catching overall. So go ahead and look up towards the ceiling there. Good, he looks pretty good there. He actually has pretty decent thoracic extension going through there. Yep. Why don't you face the camera here?
Okay.
And just turn over this shoulder here. Good.
A little tight on the right side there, yeah.
The other side.
Yeah, that one doesn't hurt.
So he's got a little bit of muscular tightness up here that seems to be restricting his motion. And then we'll just have you cross your arms across your chest and just do a little rotation through here just to check out that mid back.
Try to keep my hips straight
you're good.
forward there, so it's not
good. And then we'll go in and we'll feel the joints here and see where exactly he's locked up or what's preventing him from moving or giving him a little bit of issues.
Let me see the line.
Yeah, you can sit down here and face that way.
Still.
So one of the things we're looking for here is I'm just pushing straight through his joints and trying to feel for that end range of motion. So I'll take him to that end range where he no longer moves anymore, and I can just give a little bit of force through here. And what I want to feel is basically a joint should have a springy feel. It should almost be like you're on a cushion and there's a little bit of give, right?
Yeah.
If I press against the floor here, it's just a block and I'm not going anywhere. So usually you can get a pretty good feeling of where he might not be moving the best. So far you're moving pretty good right there. You're not moving the best.
So for me it's going to be in the mid back. I can feel it.
Now we're only checking the sagittal plane motion, which is forward, bending, and extension.
But we spend a lot of our day in this.
Yeah.
I mean, this is where we sometimes rotate. We don't typically side bend too often.
No, not too often.
A lot of this.
So most people, at least in the mid back area, they need that extension movement. So here, I can get him here, but when I give that little push, he's not giving me that springy end feel that I'm looking for. So that tells me that he can use some extra motion right through that area there. And you can also check rotation. So I'll have you cross your arms across your chest. In the mid back, the thoracic spine, extension and rotation are movements that are coupled together. So usually if you're locked up in extension, you usually won't rotate super well here. So rotating to the right feels a little bit more stiff to me than rotating to the left.
Doesn't feel as smooth to me. It doesn't even have to be painful. Just sometimes it's just the quality of movement.
Yeah.
I just feel like I don't have the same, freeness in my, it doesn't hurt necessarily,
feel
but
restricted.
yeah.
Okay, I'm going to go ahead and turn your head to the right here again. And to the left.
No, I feel right in there.
Yeah.
That one I don't.
Good. I'm just going to move you through here.
That one does it on the right side.
Good.
Yeah, right in there.
Yeah. So up here, we're at a transitional point of the spine where the lower neck meets the upper back. So those transitional segments where our cervical spine meets the thoracic spine, we call that the cervicothoracic junction.
Very common spot. A lot of the ones we did, movements we've shown, that's where we're targeting.
When this area is not moving well, it can cause some neck pain and some mid-back pain. Those transitional segments are where we tend to find the
scapular, trap, shoulder,
We tend to find the most lack of motion in those areas because the joints are changing their orientation in the planes. So of how
structurally they're a little different, but functionally they have to still, work together. Exactly. And think about how many times we can get almost all the motion we need in our daily life with just the upper ones. We're just going to be here, here. That's about all we need.
Yep.
And these just don't get moving because we just get them stuck in the flexion.
So most people tend to be tight through here, and then they tend to move more through the mid-neck, and then they tend to be tighter at the top here. Mm-hmm. So we'll check out his neck here when we lay him face down, but I just want to get a couple more range of movement in here. Now some people are scared of getting adjusted, and that's a fair fear to have. But it's pretty gentle and very safe, and they're the most common adverse effect you might have is a little bit of muscular soreness, but that lasts for like 24 to 48 hours if you ice it. If you
just like you would if you would go out and do yard work when you're not used to doing it, just a little bit of soreness. Yeah.
Okay, I'll have you lay your back here.
Okay. Head down this way, this way.
Yeah, you can get down here facing up. All right, here we go. I'm just going to palpate his neck here a little bit. So again, I'm just taking his neck here to end range and providing a little bit of force through there to see if we've got that motion. Good, and then you can check rotation here. Against the wall here, kind of move out a little bit.
Yeah. And you can take a move.
A little stiff through here, a little tender.
Yeah, both sides. The right side was tender too with the rotation.
Okay. So we'll demonstrate an adjustment here. I'll do a light little adjustment on the neck. We're going to work on the upper neck here. I'll come down the right side first.
So he's just blocking my bone on the side there. Yeah. It's not on the back or the spiny part. It's
no, on the side here. So we're on the side of that
upper transverse process.
Yeah. Take a nice deep breath in through, please, and blow that out. Good. And that's all it is.
That's all it is.
Just a light little force through that joint. Was that scary?
No. It's what's nice.
You've been adjusted for it.
Yeah. Well, it's nice when you take someone to end range.
Yeah.
And then from there, it's just a light one rather than take what happens. Sometimes people are used to, or not used to, but get experienced to end range, and then someone backs way off, and then forcefully jams it in. That's different. Like this is I think when you do it correctly, it's all the way to end range, and then just a little bit. It's a very small amplitude.
Yeah. So we can reach it. That's moving a lot better. So then we can come to the other side where he's kind of locked up, almost in that same area. A little bit lower here, so we'll do the same thing here. Nice deep breath in, blow it out. Good.
I'm done. And so you may feel and hear like a bit of a pop.
Yeah.
That cavitation, you can probably explain what that is. I mean, that's what people, I think, some want that, they're looking for that. It doesn't have to be there to be effective, from my understanding. So, and some people are scared of it, but it's just a normal, natural part of the joint moving.
Right. So all that is the pop or the cavitation is what we call it. It's just when we put that quick force to the joint, it creates a vacuum effect within that joint capsule. So the joint is surrounded by fibrous tissue.
All of our joints.
All of our joints. Yeah. And there's fluid in there. So when
it's like cracking your knuckle. It's not either.
Same thing. Yeah. So when you put that force to the joint, it just releases some gas bubbles and they pop, and that's what makes a sound. Sometimes,
but it's not the bone cracking.
No, it's not the bone cracking.
It's not anything that's it. I mean,
we're not shifting your bones back into place or anything like that. It's literally just the physics of how the joint works.
Mm-hmm.
Yeah, it's nothing crazy. We'll get that mid back moving, and I'll come back to that upper neck area because I know you like the one where I have my face.
Oh, yeah.
So with working on his mid back, we found that area right back up in here that was kind of stiff. So all I'm going to do is I'm going to take my hand and use it as a little bit lower. Breath in.
Yes.
I'm going to flip you over. We'll get that.
I knew that was the spots there.
Good.
Further up.
Yeah, you're good.
In the hole.
Right in there. Yeah. So we're coming back to that cervicothoracic junction where that neck and upper back meet, and I can still feel right in there. He just does not shift well or does not move well through there. Go ahead and take that deep breath in again, Chris. Blow that out. Good. And we'll get that other side looking just a little bit more. Breath in. Breath out. There we go.
Oh yeah, that was definitely there.
So we'll come back through, we'll just give some more pressure in here, just make sure everything's moving well. All right, Chris, why don't you sit up at the end of the table here?
Yes.
Let's go back through some ranges and motion. Hey, you guys stand up since we didn't stand up. Go ahead and tuck that chin to the chest.
Oh,
Good, and up towards the ceiling here. You're moving a lot more there.
yeah. I just need. I knew from all of the
Good.
swings and stuff that I've been doing, I could feel that it was pretty stiff and tight. So.
Yeah. Good. So
That's all it is, guys.
That's pretty much all it is.
Yeah.
Yeah. So then the only thing I'd say next is we give you that quick range of motion increase, that quick pain decrease with the adjustment. But
A sense of relaxation, a sense
Right.
of like a release of tension is really
Yeah.
what I feel. Is just like, oh man, now I feel like I can move and do more things, and then we're gonna work
Yeah.
on some other exercises.
So it's important to follow that up with different exercises to maintain that range of motion, and then strengthen the areas around the joints so that you stay out of pain longer.
yeah, that's what we do. And I mean, in a nutshell, that's exactly
that's basically
which is the difference between a lot of other places that you maybe been to or tried, and you're like, well, I'm just missing something. I got that one piece,
Yeah.
but I didn't get that piece, or I got that one piece, but I didn't get, it wasn't effective. Okay, well then this is how we're going to do, treat your problem and figure it out, putting two different points of view and two different training backgrounds together for the benefit of you, obviously.
Absolutely.
Anywhere, upper back, low back, neck, shoulder, elbow, hip, knee joint,
ankle, whatever.
all that stuff. So,
Yeah. All right, guys. Thank you. Yeah. Have a great
have a
weekend.
great Friday. Yeah. Happy Halloween.
Yeah. There you go.
Yeah.